So there's still so much we don't know about this virus. Researchers around the world continue to study it, hoping to understand how it spreads, whom it affects, and whether we can develop immunity. So here's what we do know. The virus appears to be killing men at a much higher rate than women. At least that's according to some of the limited data we're getting from a handful of countries. But researchers here in the US are now trying to figure out if there's actually some truth to that. So they're conducting a study to determine if estrogen, a female hormone, can reduce the severity of symptoms in men. Well, we're joined now by Dr. Sharon Nachman, an Associate Dean for Research at the Renaissance School of Medicine at Stony Brook University, and also from the same university, Dr. Antonios Gasparis, a Professor of Surgery. Thank you very much to both of you, because I want to talk about this study that is fascinating. Dr. Gasparis, I understand it was your idea, you thinking out of the box. You looked at the gender gaps in the death data particularly, and you had an idea. Tell us about it.
Yeah, it was pretty simple clinical observation. As you mentioned, the gender difference and the severity of disease that occurs between men and women, that's really what triggered everything.
And what was your idea?
Well, it was basically why, the question was why. You know, as you mentioned, about 80%, when you look at the risk of requiring intubation or mortality or death, it's about 80% males versus 20% or 15% in females. So why such a difference? And that led to me trying to see in the literature what do we know. And when you look at the strain of coronavirus that was responsible for COVID, it's a little bit different than what it is for other previous infections such as SARS. And that gender difference was observed also in SARS. Mm-hmm. Now, when I looked at the literature, what I saw was that some animal studies showed that in female mice, they also had a protective effect. And when there was a block of estrogen in those female mice, that protective effect was gone. So the fate of the female mice was similar to the males. So making that clinical observation that I mentioned earlier, as well as this data that I found, the question was, can estrogen administration give a protective effect to males or postmenopausal women, for that matter, to prevent lung progression to require intubation?
So this is fascinating. So I understand that you've enrolled the first patient, putting men on estrogen, this female hormone. Dr. Nachman, tell us about what you're actually doing.
So this study is a randomized study because we don't know if, in fact, it will work. So what we're doing is randomizing patients who are men over age 18 or women over age 55 in that they're postmenopausal, to by chance either get an estrogen patch put on for 7 days or placebo, and to see how they do if they are less hospitalizations for COVID, less admissions to the ICU, and in fact, less intubations.
So with you, Dr. Nachman, just to stick with that, I mean, how do you think estrogen changes the body's immune response to coronavirus? I mean, what are you looking for here? What are you hoping it does to a man's body that it's already seeming to be doing to a female body?
So we hope that it will, in fact, help their immune response when they see the virus. This amount of a patch, 7 days put on for just once, will not have any feminizing effect on the men who are getting it. It may help the women who are over 55 to feel a bit better when they're postmenopausal, but it will not have any downside feminizing effect for these patients. We do hope that will help protect them against the virus. We are only enrolling people who are symptomatic from the virus, who have positive COVID testing. So we are thinking that everyone who is in the study will in fact have already acquired COVID. So we're hoping it will protect them from progressing from the disease.
It's so fascinating. And Dr. Gasparis as well. I mean, I also understand, and I know I've spoken to a few midwives and obstetricians and many pregnant women, and this has been one of the good things. Many pregnant women, it seems, get a really mild version of corona. And of course, when you're pregnant, your bodies are pumping full of estrogen and progesterone. So do you think that is also an indication that might lead for you to suggest that, hey, there might be something here?
Yeah, I mean, exactly like you're saying. I mean, even though pregnant women can get infected, they get very mild symptoms.
Yeah.
And as they have high estrogen levels, that's just another reason to think that potentially this may have a benefit in protecting you from progressing your disease.
So what are you looking for? And what is your time frame here, Dr. Gasparis?
We're looking to enroll about the first 100 patients first and see, we expect if there's a significant difference, that we will see a trend to that after our first 100 patients, which we hope to get within the next 2-3 months.
Oh, that's quite soon. And you've started, I mean, what do you tell men, Dr. Nachman? You say to them, they're coming in with a cough, that they might have symptoms. How are you convincing them that they need to take female hormones? Is that a problem?
We're not phrasing it. We're not phrasing it, oh, take this female hormone. Yeah. We're telling them that this short time frame of using a patch with a medication called estrogen will, in fact, help their symptoms perhaps go away. And we are getting uptake from most of the men. I think the young men are perhaps a bit of a harder sell because they are concerned about, are they going to have any downstream effects from the estrogen? But after talking with them for a few minutes, they do recognize this is a serious and significant infection. And in fact, this short-term estrogen patch may help. As you know, because it's a patch, and if there's any side effect from the patch, it's easy to remove, and the levels of estrogen in the body go down relatively quickly. So there is no long-term sequelae from it.
I mean, I know this is also, there's so many doctors like you, researchers, kind of throwing ideas out there, trying all sorts of things, whether it's drugs, whether it's vaccines and all of that. There is one of the criticisms, well, then how do you explain that elderly women who have a reduction in hormones, as you were saying, after menopause, are still outliving men? I mean, if sex hormones are to play the primary factor in this disparity, then wouldn't also elderly women also fare poorly?
So we believe that elderly women, even if they are faring poorly, are not faring as poorly as men are doing. Okay. The entire story can't be just about estrogen, but if estrogen is a part of it, this study will help shed some light on the discussion. We don't expect that there will be a silver bullet. There'll be something magical that anyone who takes this medication or any other medication that's being tested will protect everybody for all ages all the time. But if estrogen is part of the answer, this study will help address that issue.
Oh, that's interesting. And finally to you, Dr. Gasparis, I mean, this was your idea, and you're obviously going to be looking at all the data. What is the best case scenario for you?
I think the best case scenario is that we can significantly reduce the severity of disease in men and in older women. I think we're not going to eliminate disease, but in early phases of when they develop symptoms, if we can help stop progression or reduce it significantly, we're talking about a difference of 80% in men versus 15% in women requiring intubation or dying. So that's a huge difference. And the question is it really hormonal? And if it is, using estrogen potentially can help bring those numbers down from 80%.
Well, good luck. I really appreciate you guys joining me. I know it's early. It's 5:15 in the morning here on the East Coast, but I know you've got a lot of work to do, and I really appreciate you joining us. Fascinating study. And all of you, good luck. And hopefully more people join that study so we can have as much data as possible.
Thank you.